Okay, perhaps we can start. Dear colleagues, a very good afternoon to all of you. I'm Nandita Bhan, professor at the Jindal School of Public Health and Human Development, OP Jindal Global University. On behalf of the Family Planning, Monitoring, Learning and Evaluation Consortium, I welcome you all to the 8th webinar, which is on the role of social networks in shaping demand for contraceptives among young and low parity women. Thank you for joining us today. So before we deep dive into today's session, I want to make a few introductions. Firstly, I want to introduce the FPMLE Consortium. I think many of you are already familiar, having joined our webinar series. So the FPMLE Consortium was constituted 8 years ago with a goal to provide grounded evidence on efforts to improve family planning in India, with particular reference to Bihar and Uttar Pradesh. The consortium was led by the Population Council, and it brings together technical support units in Bihar and UP. So Care India Solutions for Sustainable Development in Bihar and the India Health Action Trust I had in UP. And also the International Center for Research on Women, ICRW, and the Center on Gender Equity and Health, GH, UC San Diego, to collectively support the family planning program with data-driven evidence. So today, our presentation is based on, one quite fascinating study within the consortium. And so the study really will talk about the role of key influencers and trying to understand pathways of influence in making contraceptive choices by young women. So this presentation, very briefly, I don't want to give away too much, but just as a background to today's, exciting presentation. So, despite all the progress, young and low parity women continue to experience barriers to demand and access family planning information and services. So prevailing social and gender norms, such as pressure to prove fertility soon after marriage, govern decisions around timing, number of children, as well as contraceptive uptake. Evidence suggests that family planning behaviors and practices are often shaped by attitudes, beliefs, and practices of the different actors present in an individual's social networks. For young and low parity women, there are multiple circles of influencers who can positively as well as negatively inform, their choices and decisions on family planning. And despite the importance of social relationships in family planning, attention and execution of social network research has been somewhat limited. So to unpack the role of key influencers and to understand the pathways of influence, an egocentric social network study was designed and conducted in the states of UP and Bihar. Learnings from this study provided critical insights on the role of networks in determining use of modern contraception among young and low parity women. And this has, as you can imagine, important implications for family planning programs. So we hope to hear more about the study, more about the design, more about sort of, what was sort of endeavored and what was analyzed today. And I hope that you'll ask a number of questions that will make this webinar a very interactive one, as well as your comments and feedback, which can enrich this work further. So while I introduced the work as well as the FPMLE Consortium, I have to make two more introductions very briefly, and then I will, hand over. So firstly, it's my pleasure to, to invite Dr. Abhishek Gautam, Associate Director, Research, Gender and Health, who is at the ICRW Asia Regional Office in New Delhi, India. Abhishek is a statistician by education and a demographer by profession, and has more than 18 years of research experience in the field of monitoring and evaluation, specifically in the areas of gender, family planning, reproductive, maternal and child health, adolescent health, violence against women, HIV, and water and sanitation. In his role at ICRW, Abhishek provides technical and managerial support across a wide range of research and evaluation projects in the Asia office. Prior to joining ICRW in 2011, Abhishek worked as Senior Technical Officer, Monitoring and Evaluation in FHI 360, there he is, on the project Avahan, India AIDS Initiative Program. Abhishek has also worked with TNS India Private Limited, where he led key projects such as the National Family Health Survey Round 3 and behavior change communication projects in Jharkhand. Abhishek has earned a doctorate in statistics from Banaras Hindu University in Varanasi, India, and he holds an MPhil in population studies from the International Institute for Population Sciences in Mumbai, and has a master's and bachelor's degree in statistics from BHU. So welcome, Abhishek. But before I hand it to you, I also would like to introduce our discussant. Also my pleasure to introduce Mr. Indrajit Chaudhary, who serves as the CEO and country director of PCI India, bringing more than 2 decades of experience in managing and conceptualizing large-scale development projects in India and other countries. With a passion for development and flair for innovative thinking, Indrajit provides the organization thought leadership in designing solutions for holistically impacting community development. His expertise in measurements, program designing, and scale-up of intervention is well regarded. He is recognized for integrating health and nutrition interventions into community platforms, resulting in measurable improvements in nutrition indicators, for leading an innovation to develop ICT application for Anganwadi workers that got scaled up nationally in India, designing several programs that got scaled up globally, and establishing one of the largest concurrent measurement mechanisms for outcome assessment. Additionally, Indrajit specializes in developing strategies for scaling transformative social change programs in alignment with the government that empower women, girls, and marginalized communities to achieve their aspirations. So welcome, Indrajit. So the program for today will go as follows. So we have Dr. Abhishek Gautam present for about 20 minutes, and this will be followed by Mr. Chaudhary, who will be sharing his views and on the subject, and then we'll have a Q&A. So we look forward to having an interactive sort of session and to hearing your feedback and comments on the same. So please actively use the Q&A as well as the chat window to give your feedback, comments, suggestions, whatever, and we'll take them up after all the speakers have sort of shared their views. So with that, let me just hand over to Abhishek. Over to you.
Thank you, Nandita. And on behalf of FPMLE Consortium, I again welcome you all for this webinar, which Nandita has already laid down the context. It's on role of social network in shaping demand of contraceptive among young and low parity women. Just give a second. Okay. Yeah. So as we all know, the decisions around family planning are rarely taken in vacuum, and there are several factors that operate at different level of the ecosystem, which shape and influence the choices and the decisions. And that's what we are trying to unpack using the social unpack and see the social network of young and low parity women and couple, and how the network members play a role in influencing or shaping the demand of modern contraceptive use for this cohort. And finally, towards the end, definitely whatever research studies we do, we would like to feed it into the program so that how we can leverage the learnings in our existing or upcoming FP programs that can address the demand side barriers to FP use. Moving forward, just to give a context before getting into the learnings, and though I know most of you who are here are well aware of the FP scenario in India and the social prevailing norms, which Nandita also talked about in her introduction, that when in last 5 years, it's quite a relief to see the increase in MCPR. Though, and the shift that we have seen in the method mix and increased contribution of the reversible method. However, the prevailing norms that we have in our country and the practices around, specifically around fertility, still continues to be there. The pressure to prove fertility as soon as you get married, having a child soon, that all results in early or unplanned child pregnancies and childbirth. And these pressure gets eased out only when only after birth of first child, and preferably if that's a son. And that's the reason, because of these prevailing norms and practices, the modern contraceptive prevalence rate among young and low parity women still continues to be low. And in entire presentation, when we are saying young and low parity women, by that we mean young means women in the age group 18 to 24, and low parity, by low parity we mean women in parity 0, 1, and 2. And it is, we all know that it has been widely recognized that intention to have a child, or the value that is attributed to the children, or the support that is available to the couple, the norms regulating the parenthood, are created and diffused and transformed by the social interaction and the relationship and its dynamics. We do have a lot of evidence which point towards the role of individual family members like husband and the mother-in-laws. We all know that husband are the primary key decision maker in any household, and is the person who has the final say when it comes to family planning. And similarly, the mother-in-law, who is considered to be a custodian of the social and gender norms in the community, which have a strong influence not only on the number and timing of the children, but also on the mobility and the interaction a young newly married woman can have. However, what we lack in this is the evidence on the role of social network as a whole. How these influencers interact with each other. What are the pattern and dynamics of their influence? And in what ways does this nexus of these relationships shape individuals' attitude and behavior? Thus, with that aim, what we try to unpack in this study is identify who are the people in the network, what kind of relationship they have with the individuals, and how they shape the woman's family planning decision and choices. What are the different nature and issues over which these influencers exert support or show concordance with family planning? And then what are the mechanisms, the processes through which individual, family, or community interact and operate and have an influence on the contraceptive pathways, and how these learnings can inform FP programming, can engage and how our FP programs can engage the key influencers and address the demand side barriers. Now, to do this, we opted for the social network analysis approach. Now, social network approach provides a tool to examine the social network and the dynamics of their relationship. What it does, it helps us to map the individuals and their relationship with the other network members, whether it's a formal relationship or informal relationship. It helps us measure the strength of the relationship and also look at the pathways through which they themselves interact and operate and influence the particular individual. Within social network, there are two types of approaches. One is sociocentric and one is egocentric. And since our study focus or objective was to look at the network of young and low parity women, so we opted for egocentric network approach, which allows us to map the network of the central individual, who for us is young woman, and help us in understanding how social interactions shape their key decisions and choices. Now, if you look on the right-hand side, the YLPW1, the woman in red, is our key index woman about whom we are mapping her network. And as you can see that there are 5 people in her network which are related to her directly, as well as they themselves are related to each other. And this study also allows us not to restrict ourselves only in understanding the network of this woman, but also go one layer above, where we can see who are the people in the network of these influencers of that woman. So for example, in this figure, if you see YLPW alter 1, we have also mapped his own alters, who are the people in that influencers network. And then these dotted lines and lines represent the interconnectedness of the network. So this is what egocentric design that we have opted and used in this study, which help us to understand the network people, how they interact, how they are connected, and then how different kind of attitude, beliefs, and perceptions are built, and how they finally influence the practices of contraceptive use. Now, as Nandita also said, this study was done. Our target group is women in age group 18 to 24-year-old and 0-1-2 parity. And this study was conducted in 2 districts of Bihar and 2 districts of UP. In UP, it was Aligarh and Fatehpur, and in Bihar, it was West Champaran and Darbhanga. And the sample size was drawn from a study conducted by Population Council with married women in the age group 18 to 49. But since from there, we took a subsample of women 18 to 24 years and did a purposive sampling because we wanted to have women with varying characteristics. So what we did, we intrinsically stratified the sample by some key characteristics like migrant husband, contraceptive use, age, and parity. And then we finally selected the women. So in this study, we interviewed around 311 women. Who reported around 1,364 people in their network as the key influencers. And as I said that we went one more level up in this study. So we reached out to 851 of those key influencers and also interviewed them. And in their interview, we came to know about 3,000, they reported around 3,587, their network members. Now, one of the key things in this egocentric design is identification of the individual. And we don't have many studies that have used this methodology specifically in family planning. So for us, it was the first time we were using it. So how best we can use, or in what way the tools need to be developed so that it helps women in identifying or reporting the network members. So we did a literature review, and then we also carried out a small formative study where we tested different combination of questions as well as different questions that could help women in identifying. And since our objective was to not only to explore the family planning network, the people who influence on family planning, but also the overall network of the women. So these are the 3 questions after formative that we tested and used in our study. So we started with a broader network, like who are the people in the network with whom you can talk freely, or you can discuss any of your personal issues like family matter, emotional matters, or health related anything. And then we narrowed down and asked about, okay, who are the people to whom you go or you will go when you seek information or you seek advice around family planning? Who are the people to whom you will reach out, or to whom you reach out? And lastly, the last question was whose opinion matters to you, whose views will you consider, or whose reactions you will keep in mind when you are finally going to have, when you are going to take decision around number of children, when to have them, or what family planning method do you want to use. So using these 3 questions, we asked women, and for each questions, we asked her to report up to 5 influencers or the key people. And depending on the appearance of those people in these 3 questions, finally, we decided on 5 individuals whom we considered as her influencers, and then deep dive into the other details, like for how long they have known to them, what kind of support she receives, what kind of learning she had from them, and all these questions. Now, when we administered these questions and finally selected, this is what the kind of network we got for the women as well as the network of the influencers. These are different set of people who appeared there. Now for the ease, what we did, we categorized into 3 broad relationships. One is the family, the second is health worker, and the third red one, which you can see, is non-family. Now, as you can see in the figure, the network of the young woman is very confined and restricted to immediate family members like husband, mother-in-law. Out of 311 women, almost 310 reported husband as one of her key influencers. Similarly, sister-in-law. And only half of the women were there in whose network we could find a health worker being reported. Now, health worker includes ASHA, doctors, pharmacists, ANMs, everything. They all have been clubbed into this category. On the other hand, if we look at the influencers networks, that's wider and diverse, and it has more, though it also have higher family members, but of other in other relation also, as well as some outside members also, like they have non-family members also, friends, neighbors, and health workers. So Ego's network is very confined, whereas Alter's network is wider and diverse. Now, in social network analysis, there are a couple of measures which help us to understand the structure. Now, we have seen the composition of the network. Now, it was important to understand what kind of a structure this network has. So, one of the measure is homophily, which tells us the similarity in the characteristics, like between Ego and Alter, means woman and her influencers, and the influencers and their influencers. And if we look at it, what it shows, like if we take a woman and her network, almost 73% of the network member belong are of same gender. Similarly, on caste, 80% of them are of same caste, and almost both in Ego, women's network, as well as her influencers network, 98-100% follow the same religion, and around 2/3 live in same household or same village. Now, yes, what we see here is the Ego and Alter networks are highly homogeneous with respect to socio-demographic character. But what does it mean for us? Now, diffusing any new information in a homogeneous network is very challenging, because unless and until you have someone from the outside who can infuse or come into your network and share words, the homophilous network is not going to accept. But studies have shown that if we infuse information or new knowledge through a existing member of the network, then it is well received by other, because member, due to the trust and the cooperation that they have towards each other. And since we know who are the people in young women's network, so targeting or engaging them in our family planning program and infusing information, new information or correct information will be very helpful. Similarly, the other measure that we have is on tie strength. Now, tie is basically the connect between individual and the network member. And tie strength is something that reveals the intensity, duration, and quality of tie. But how long you have known this person, what kind of information sharing you have with this, what kind of support you receive. So it's a combination of couple of indicators that has been used to develop this tie strength measure. And as we saw that the women's network is pretty confined, with mostly the immediate family members in the network with holding a very strong tie strength. Similarly, in the influencers network, though it's diverse and wide, but the strength of the relationship with those relations also is very strong. Like with son and daughter, it's 3.9, brother-in-law, again, it's 3.9. And the tie strength between the health worker and the influencer is stronger as compared to what we see in Ego's network. So these are two methods that help us to the homophily and tie strength that help us to understand the composition and the structure of the network. Now, there are some, as I said, that this SNA does not only help us to understand, map the network, but also help us in understanding the pathways. And these are some of the pathways indicator that we captured in the study. Social learning, which is like what people in the network share with you, what you have learned from them, and in what ways that can benefit wider socio-ecological system. Then we have social influence, which is a tendency of the people to change their behavior or attitude to meet the demand or expectation of the social environment. Now, this can happen in various ways. Either complying to someone's instruction who has greater power or authority, which is like obedience, or by adopting the behavior that is being exhibited by a majority of people in the group, means confirming the same. And it can be through peer pressure also. And these pathways can explain how people's attitude and emotions and behavior get shaped. Lastly, the social support, the kind of support that one look for or receives from the member in their network. And on these indicators, when we looked at the ties, so in social learning, if we see that talking about number of children is reported by most of the people, they have also talked or heard about FP method, but this kind of discussion is lesser than talking about number of children to have. Only 1/3 of the ties, means only among 1/3 of the connections, women reported that she received information on the side effects. So, and when we look at the social influence, now encouragement to use FP method is in 1/3 of the connections only. Now, perceived in which is now perceived encouragement or discouragement to use the FP method, which is also an important factor which determines the actual use. So what we see here, though there is social learning, there is conversation happening around family planning, there are discussion happening, but it does not necessarily increase the perceived encouragement of the woman that woman receives from our network, and which could be around the modern method, which is well obvious, which could be due to the reason that she also there are social norms and practices under which she is that influence her more. So even if they are talking, it's not necessary that they will be using or they will feel encouraged to use. The social support. Now, as we can see, there is a huge social support. The woman perceives that if she want to delay the child by 2 years, she perceives that if she whether she will get support or not. Most of them reported that yes, in the connections that we have, the network member will support if I want to delay. If I want any help or need any advice, I can freely or comfortably go and ask to the network members, and they will provide. So the learning that we have here is, despite there is a social support, the interaction and the influence on FP specifically varies. Now, what we tried to do is we created, using the 4 measures of social learning, we created a composite variable having comprehensive discussion on FP, whether they talk about number of children, whether they talk about FP methods, the place from where they can get, as well as they discuss about side effects and frequent FP discussion, and whether they feel encouraged to use modern method. Now, these 3 key pathways indicator we tested in 2 models. One was a single predictor model, means where we just control for age, education, and caste, and used 1 variable at a time. And then another model, we used all the 3 predictor in 1 model, and try to see whose influence is more. And as you can see that having a comprehensive discussion, both in a single predictor or a multiple predictor, has a strong and positive influence, as well as the perception of being encouraged to use modern method. In frequent discussion, only the frequent FP discussion didn't come positive in multiple predictor mode. What it reveals that the pathways of the social learning, the pathways like social learning and social influence are the critical determinants and are strongly associated with the women's modern contraceptive use. Now we again, since we know who are the key influencers in the network of these young and low parity women, so we use these key pathways and try to look at by the alters or by the influencers in them. And as you can see, the strongest and significant impact is by the husband. So if husband is there in the network and is having a comprehensive FP discussion with the woman, the likelihood of her using a modern contraceptive is very high, and it holds true for having a FP discussion with her, or if she perceives being encouraged to use modern method. Similarly, for other members also, like in case of mother-in-law, having a comprehensive discussion on FP has a strong and significant association. By mother, having a frequent FP discussion also has a positive and significant association. Similarly, in case of sister-in-law, which is a peer of the woman, there is an interesting pattern, like having a comprehensive discussion on FP shows a lesser likelihood, means there is lesser chance of her to use a modern contraceptive. But if the woman feels encouraged to use, or she perceives that her sister-in-law will encourage to use any family planning method, then the likelihood enhances. Now, there could be one reason that sister-in-law having a comprehensive discussion doesn't mean that the correct and complete information is being passed on. There is likelihood of talking more about side effects or the prevailing myths and misconceptions around any method. But if a sister-in-law has used or has experience of any method, then she might have shared it with the woman, and woman may feel encouraged to use modern method. And same is with the mother-in-law, where we see that frequent discussions are happening, but still the likelihood of woman is less. Now, coming to the health worker, we don't see any significant association, at least on these three key pathways indicators. But what we see in means we also have another pathway indicator was how easy or difficult it is to go against the advice of the health worker, as well as the other network members. And on that particular indicator, both in quantitative as well as qualitative that we did, it is clearly evident and strongly coming out that when health worker advises something, then it is very difficult for the woman to go against it. And it's strongly associated. So, as we can see that with all the network member and especially the family ones, there is some or other key pathways are working, and modern contraceptive use among YLPW is not only shaped by the discussions and encouragement from close family members.
Abhishek, may I request you to wrap up in a couple?
Yeah, I'm on the last slide now. Thank you. So husbands, as we know, are major influencers, are the strongest influencers, and engaging them not just as an influencer or decision maker, but as an equal partner, and working with them on transforming this skewed power relationship by using different mechanisms and tools like financial planning could be and emphasizing or placing FP as means to achieve not only his goals, but as a couple's collective goal can be a very important and beneficial entry point. Secondly, we know that currently Asha or the health worker do not focus in the network of young women, but their role is well recognized. Their advices are well taken. Thus, it is very important, we feel it is very important to build the capacity of Asha on gender issues and power dynamics that prevails and how it impacts their lives as well as their interaction with women and their families. And also for her to understand the context of young women and build trust and bring new knowledge can lead to better outcomes. Lastly, the young woman peers that we have seen, like the sister-in-law, the woman in age group, basically 18 to 35, who are key influencers, engaging them can have twofold benefit. One is it will not only help them to address their needs, but also enable them to provide correct and comprehensive FP information to other young women in their network. And as we know, as we have seen, that it's a largely homophilous network, so infusion of new knowledge from a trusted network member is very critical to promote acceptance and use. Yeah, thank you. And happy to respond to any queries and questions that may have. Over to you, Nandita.
Thank you for for this very interesting presentation. Especially there are lots of learning points in terms of understanding the pathways and what that means for programs. So I want to invite Indrajit to reflect on this presentation, but also more broadly on, this work itself, what this work on social networks can sort of help us in thinking about family planning programs and the directions where we should go. So over to you.
Thanks, Nandita, and thanks, Abhishek. I think it was great to hear such a deep work. I'm sure it's a social network analysis itself is quite a complex design, quite a complex study. And congratulations to you, first of all, to be able to do it and able to also present it in a in kind of a manner in which everybody can understand. So that's a great big challenge. I understand, but it was quite a music to my ear, and maybe many others who are working in this field, is to see that such a strong connection. And we always knew it. There are other studies also which has proven it from other geographies, but that pathways of the social learning is a strong and key predictor for adoption. So that was that's coming quite clearly, Abhishek, from your study. So I think that's quite congruent with what we understand from the field as well. What we have learned, what we have seen in the field, it is quite congruent with that. One very important finding of this study, I'll say, is also to see the influence of sister-in-law. I think most of the time when we always known that husband is a very key influencer, and the discussion between husband and wife are quite important for family planning adoption. Mother-in-law's influence is also very well regarded, but sister-in-law somewhere was slightly not so much overtly addressed or overtly programmed in the most of the programs that we generally program. But here what we are seeing, I think two things. One, they are pretty strongly in the network because they're also of the similar age. So they must be talking to each other more frequently. They must be taking their advices more because of their homophily in terms of age, more than the mother-in-law. I think that they're in the network. But the other thing that has come up, which is pretty interesting, is that many of the times when the ego is actually discussing with the sister-in-law, their adoption possibility is actually decreasing. So that says that probably a lot of myths and misconceptions which are there in myths and misconceptions, that those are there in their mind, in the mind of the sister-in-laws, are also getting transmitted. So I think this shows a very important that sister-in-laws are important stakeholders, and we need to address in our programming in a more intentional way how we can address this concern. I think that's quite a revealing, at least for me, and I'm sure for many others also from this study. I think it's a good important learning for me. I think I'll speak about a few things that we are anyway using social network in many of the programs for quite some time. I think in 2016 we started with this CRP couple program in Bihar. Then we did this Khushhal Parivar, something with the self-help group network of Jivika, where we had found that it is important that the influence of opinion leaders of the village and influence of so we need to target at various different levels. First, to start with the opinion leader in the village, then within the family. When you go to the family, the ego or the primary young low parity woman is not your first target. Your first target should be the other people, primarily the mother-in-law. There we are trying to do it with the entire family. So the logic of the program was to start with a Khushal Parivar, means a happy family, how a family can be happy, what all makes a family happy, etc., and what are the happiness ingredients, and also their finances, their lives, those things. And those discussions happens with the entire family before we move to before we move to the actual couple for the discussion. So that we found that quite an important, like a lot of benefit of doing that. Like, I think it has shown a good amount of results while we did that. Another thing that we did, I think it was an ethnographic study in which we are trying to understand whom women, that was not a young and low parity, but we are trying to understand when the woman is supposed to feed their children, from whom they take the advice. So we found over there is that, of course, the mother-in-laws and husbands, etc., all are influencer. But we over there found that their mothers in their who are not there in the village and who are not there in the program are also very big influencers. I think here also it has come, the influence of mothers have also come quite importantly. And mothers are also generally, because the way we do programming, mothers are generally out of our programming in most of the cases. So I think that is quite congruent with the studies that we have done. The main engagement, of course, like the husbands, as usual, has come up to be one of the most important influencer. And I'm sure all of us have had multiple experience of multiple projects programming with men. And I think one of our recent work on men engagement, which we tried to do in Bihar with us and Dalberg, designing a way of doing men engagement. We actually used something called a financial planning course. So engage men. So we do not go with the family planning as an agenda, because as you go with the family planning as an agenda, it becomes, so it's not my agenda. Okay, talk to my wife or something. Men always feel like they do not really engage. And for health worker, we have always found, for a ASHA or Anganwadi worker, for ASHA specifically for the case of family planning, for them to engage with the men was always very challenging. Because men do not really consider them as a person from whom they can take the advice or information, etc. So what we did over here is we used a financial planning course, so that you'll be try to talk. We will be taking you through the financial planning course, financial planning of their individual aspirations, financial aspirations, etc. Through that, we engage them with the family planning, and we found that quite useful way of doing it. I think overall, Abhishek, I'll say mostly your findings are pretty congruent with what we generally see in the field. We already keep trying. We have tried previously also of using social influencers, family influencers, as well as other network influencers, particularly the self-help group and the village organization that is created in the self-help group, where even the older women, they create many times they actually becomes an altar's altar. So many times those mother-in-laws get influenced by other women in the village, and giving a right information over there to the altar's altar was always effective. That's what we are finding. We never did a social network analysis. Big important learning for me and many other programmers who are hearing this is the sister-in-law, and it is important to do a programming based, very intentional programming for sister-in-law is also important. That was a very, very important learning. Male and husband and the couple conversation is as usual has come up in this study also. So quite congruent with what we see in the field, and quite interesting, revealing for a few of this, specifically the sister-in-law and the myths that many times they are actually propagating the myths. So that's quite an important learning for me. I believe, and I'll be happy to discuss more if there's any question. Over to you, Nandita. Thanks.
So we don't have any questions yet, except when are you publishing this, Abhishek? And obviously people want to read this study and understand the intricacies of this in a lot more detail. But as people maybe think, let me give them a couple of minutes to think about questions more. I think I just wanted to reflect on two things that I particularly find fascinating, and I hope I understood that correctly. Well, the first one is, I think this is like the first time that I'm seeing like network analysis being used to really describe how socially isolated girls are, young married girls are, because their social world is essentially their family. And even the health worker is somewhat limited. And I think we have seen, at least in the field, we've seen anecdotal evidence, both in terms of, field workers themselves, not field workers, sorry, health workers themselves almost censoring, self-censoring and saying, oh, let her have her first child and then I'll go to the family, or, things like that. So we've seen anecdotes of that. And we've also seen that, young married girls, particularly those who marry quite early, are also, they don't have as much freedom of movement. There's a lot of domestic labor. So basically the social world is their family. So I think this is the first sort of, almost visual, that slide of yours where you showed, the world of the ego and the world of the altar. You can kind of see that very starkly in front. So I thought that was very, very remarkable. I think the second thing that I found interesting was the slide where you showed that comprehensive conversation doesn't always mean modern contraceptive use. It can go in different directions because it really depends on who you're talking to and what that conversation is about. So perhaps if I understood that correctly, I think your comprehensive conversation with the mother-in-law means that perhaps at that point you're negotiating wanting to use modern contraceptive use in a way. And when you're talking to your sister-in-law, you're kind of getting feedback. And we see a lot of the times in the field, a lot of evidence that I think, as Indrajit said, there's a lot of myths and sort of, there's a circulation of a lot of, experiences and often, unfortunately, adverse experiences that women have with the healthcare system. And that actually makes women step back instead of going forward in terms of accessing, modern contraceptive use. We see that in many areas where, and particularly, I think my experience has been more in terms of, women's experiences with IUDs sometimes have not gone well. And I think that has often deterred other women. So, that whole piece that I think you were trying to bring out around, there needing to be more information about side effects. And, that conversation to navigate that. And how do you do that? I think that was very, very fascinating. So I think programs have to perhaps reach out from, we often, do work where we think, okay, we need to reach out to the husband. I think Indrajit said that now increasingly there's a lot of awareness of talking to the MIL, but I think the more and more we disseminate information, the better it might be, the whole sort of network gains as a whole. So I think your findings, the richness of that is very, very fascinating. And almost is the first time that I'm seeing this, in fact, happening visually for me. So yeah, if you have any thoughts on that.
Thank you, Nandita, and thank you, Indrajit. And just to add on a couple of points that Indrajit, you also said, and Nandita also emphasized about the sister-in-laws. One is definitely the kind of myths and misconceptions or the experience of side effect that they are discussing or telling, which are restricting the woman to use. Another reason is the sister-in-law has passed that gender and social norms herself. And she also is not going to promote, or she also wants the other one to go through it to a certain extent before. That's why. And one more important thing, both in case of mother-in-law and the conversation that we have heard, and from the qualitative, basically what we learned, the discussion that happens, especially in the lower parity or the zero parity, even if there is some conversation around family planning, it's not around the modern methods. It's mostly around the traditional methods that happen. And once they have achieved the desired size, or they have one son, then somewhere mother-in-law wants to, okay, now you can delay the second birth, and then you can opt for modern method. So these are also some of the findings that we have in qualitative, which comes out and very evidently.
Indrajit, if you have any thoughts, I had one sort of question for Abhishek.
Yeah, there is one question I've also seen. I think no, I think one thing that that is very coming importantly, probably we can look at it slightly more deeper, probably looking into the social norms around it, like the norms around this family planning, and how the network is actually establishing those social norms more and more through by perpetuating the norms. So I think that's something that probably will be a good thing to look at, because we believe that we have understood, or we have learned over a period of time, is that once something, like if it is normative, then it is very difficult to break, and a norm shifting intervention cannot happen through a one-on-one conversation, or IPC many of times are not a great way to do a norm shifting intervention. So probably we need to have a different kind of programming for norm shifting intervention. Some of those we tried also, like the ones I was talking about in Kushal Parivar, is particularly to start with the community, start with the elders in the community, and going to the family elders, and starting over, like talking over there. So I think that is from the programming side, what is how it needs to. I'd love to hear a little bit more from Abhishek. What do you find in terms of gender norm, prevalent gender norm, whether those things are being discussed within the network of the young low parity women?
To a very less extent, not too much around those things. I mean, one is definitely those social norms everyone is facing, and as we saw that the women's network is very confined to the immediate family only, where it's husband, mother-in-law, and except for the sister-in-law, there is no one else in that particular age group. So even to women to discuss, like even during the formative as well as qualitative, there is we found very less discussion around social norms or the pressure that they have, that they can share freely with someone. Because for them is the mother-in-law, the very first person comes is the husband, who himself is under the pressure from their parents and the society. So that's very less.
We have a number of questions, but I think Abhishek, you probably answered these. So I think there was a question on media, and you said that I think you've answered, or yes. So did you explore role of media in terms of your social network, and also who are husbands' main alters? I feel like
yes.
You've answered both of those.
So we did try to capture, apart from the people, means the key network members, are there anyone else outside who influence them? And we had a series of, we asked about the village functionaries. What is the perception of the women about the village functionaries, like the religious leaders, Pradhan, Asha, ANM, how they perceive their work, whether they feel that these people encourage the use of modern contraceptive, what is their perception about their work. Those means that's another set of insights that we have. And it was very interesting to see that women do know a lot of pharmacists, a lot of Pradhan, and for Asha and ANM, everyone, including the husband, has appreciated the work that they do, and they feel encouraged. They feel that Asha ANM encourages for the use of family planning. But when it comes on, have you received what Indrajit, you were also saying, when the question was asked, have you ever received any advice about using contraceptive from them? Then it was a big no kind of thing. Means the proportion suddenly goes down for that. So it's not, means people know them, they believe them that they are doing good work, and they also feel that they encourage others to use contraceptive, but when it's come to them receiving an advice from them, then there is a gap, big gap.
Okay, I will ask one more question before we close this seminar. But basically, so Abhishek, you have a lot of experience in designing qualitative work, but how challenging was doing a social network study in terms of explaining, to your teams and, even like junior colleagues, what you were doing, how to do it, like how reflecting on that, like how challenging was that?
The challenge still continues, Nandita. Every day we deep dive into the data and we find something new. But okay, yeah, in terms of field implementation, yes, it was the first time we also implemented this study, and there were a couple of things, means keeping a track of who is the ego, who are the alters, what are their address, then whether that alter has been reached out or not, and means I don't want to scare you all, but it was like 24/7. That after entire day field work, we used to sit, map down who are the influencers that have been interviewed, who are not interviewed. And then another challenge that we faced was meeting them physically, because a lot of interviewers were outside the village, or to whom we tried to reach out over phone, which was pretty challenging. And another challenge that we face, though women said that XYZ member is a key influencer for me, but when we asked, can we interview them or can we go and meet to understand their network, it was in many of the cases we were asked not to reach out to them.
No, you are not at all scaring. I think that's the reality. I think the methodology is beautiful, but it's also extremely challenging to implement in the field, to explain to people what you're doing, and to sort of draw the line when do you stop on chasing alters. So it's not easy. You can go on and on and on and capture the whole sort of universe.
Explaining the three questions, though it looked very simple here now.
Yes.
But during the training, how it has to be administered, how much time you have to give to the respondent, because, and that's all for us also. If someone comes and asks me who are the key people to whom you confide in, then all those who are present in front of me, the very first I'm going to take their name. And then you misses actually the person who is with whom I feel very comfortable, but that immediate at that point of time. So one has to give time, wait for the response, remind.
Probing.
Yeah.
A lot of probing.
A lot of probing.
No, I can totally imagine. Any final reflections from you, Abhishek or Indrajit?
Indrajit?
I think it was quite fascinating, and I completely understand that it's a very, very challenging study to conduct, and a very, very even more challenging study to really do the data analysis of this. I tried it at one point of time, so congratulations for doing that and explaining it in a more language that everybody understands is even more challenging. So congratulations, Abhishek, for doing a fascinating study. And I think there are a lot to learn from here. I think we got a gist from here, but of course there are more into the data, because there are multiple things that will come as you do more analysis, and we'll look forward to your data and paper and a more bigger report as it comes. Thank you.
Sure, Indrajit. And even that's what our objective is, to bring out the different pieces. I would say this is just 1/3 of the data that we presented today in 20 minutes. We cannot do more, but there are a lot of things, and we would like to share with you all, so that you as a program implementers can take it forward and it can be used in actually designing the program and strengthening the current programs further.
And there is a lot more value in having multiple and, like a diversity of methodologies, because we often do surveys and that give us certain types of information. We do qualitative, we do ethnographies that give other types of, data. But I think this is certainly a kind of methodology that we don't see very often. And I think when we do, we have to appreciate the amount of effort that goes into thinking about it and, analyzing it and so on. So thank you, Abhishek, so much. And thank you, Indrajit, for your very, very insightful reflection. So, and thanks to all for joining and, spending the afternoon with us. Thank you.
Thank you, everyone.
Bye-bye.
Bye.
Great.
If